HIPAA. HIPAA stands for Health Insurance Portability and Accountability Act. HIPAA governs the uses and disclosures of protected health information, or PHI. Use means any access within the organization. Access in Epic to patient charts is included. Disclosure means any release of PHI outside the organization, family, friends, or vendors. PHI is any and all individually identifiable health information, such as name, social security number, diagnosis, etc. Uses and disclosures without authorization. Uses and disclosures without authorization are mandatory to the Secretary of Health and Human Services or to the individual that is the subject of PHI. Uses and disclosures without authorization are permitted for treatment, payment, and operations purposes, law enforcement, business associates, and incidental disclosures. Non-permitted uses and disclosures without authorization include breaches. Incidental disclosures. HIPAA allows for incidental disclosures, such as overhearing another patient's information, so long as reasonable safeguards are taken to prevent transmission of information. Safeguard examples. Speak in a lower volume. Turn up television volumes. Find a private area if requested. Regardless, be mindful of conversations you have in public areas. Minimum necessary rule. The minimum necessary rule limits the use or disclosure of PHI to the minimum necessary to accomplish your intended purpose. Do not snoop. Minimum necessary means stay within your workflow. Do not access your own chart. Do not access your coworker's chart. Do not access family members' charts. And do not access friends' charts. Consider the minimum necessary rule when sending records to outside entities, accessing information in Epic, discussing patient information with coworkers not involved in their care. Minimum necessary includes compliance capabilities, including the Maize monitoring and Epic audit trail. The compliance department can see the date, time, areas of a chart you access through the use of these capabilities. Maize. We are patient first at LCMC Health. Our patients will be seen quickly, have a great experience, and be safe. What is Maize? Maize is a privacy monitoring solution that works with Epic to ensure compliance with healthcare regulations and internal policies. Maize can decipher inappropriate Epic access from the access required to do your job. Why Maize? To help protect the privacy of all patients, including employees who are patients. To help us proactively detect access issues instead of waiting for them to be reported. Self-access. Do not access your own record. Know and abide by facility policies. My chart is for personal use. Epic is for work-related use. Colleague access. Do not access a coworker's EMR without a work-related reason, i.e., on your work queue, involved in direct patient care. A coworker asking you to go into their EMR is not work-related. Log out of workstations and devices. HIPAA privacy rule tips. Avoid discussing patient information outside of the workplace with family and friends. Avoid discussing PHI in open areas. Find a private space or use a lower volume. Be mindful of paperwork, the number one source of breaches at LCMC. This HIPAA privacy rule covers all PHI, electronic or not. HIPAA security rule tips. Secure areas should remain secure. Close doors behind you. Ensure computer monitors are visible to only you. Encrypt mail going outside the LCMC network by typing secure in the subject line. Always secure your workstations and computers before leaving them unattended. Any clicks on your computer will be tracked as your access. Never share passwords with coworkers, with websites. Do not leave them on notes, electronic or paper. Never click on links from emails where you do not know the sender. Attach to email and send to fish@lcmchealth.org. Be sure that personal devices, such as thumb drives, are properly encrypted. Do not plug unencrypted devices into LCMC computers. These security rules cover all ePHI. HIPAA tips for interacting with patients. Any breach of confidentiality can result in automatic dismissal. Keep the patient covered when transporting them in the hospital. Give the patient their personal space. Ask before touching anything in a patient's room. Leave the room when a physician arrives or during family phone calls. Reporting concerns. What to report? 1. Ethical concerns. 2. Potential HIPAA violations. 3. Suspected wrongdoing. 4. Fraud, waste, and abuse. All employees are encouraged to report concerns. Employees can report anonymously. Employees will not be retaliated against for making reports in good faith, even if their concerns are unsubstantiated. When making an anonymous report, give as much information as possible so that every report can be investigated thoroughly. Be Safe is available to report patient safety or quality issues. How to report concerns. Call the compliance hotline 1-855-9-COMPLY. This is for anonymous reporting 24 hours, 7 days a week. Hotline web reporting. Report all patient safety concerns through the Be Safe web reporting system. Report all suspected wrongdoing, HIPAA issues, ethical concerns or fraud, waste, and abuse concerns at lcmc.ethicspoint.com. Contact the Compliance Department at 504-896-3030 or at compliance@lcmchealth.org. Mary Ann O'Brien is the Chief Compliance Officer, Kathleen Sitoon, Director of Compliance, and Katie Adams is the Compliance Analyst. HIPAA Case Scenario 1. Question. You learn from another volunteer on your shift that a famous celebrity's daughter is receiving treatment at the hospital. Out of curiosity, you decide to look around, and you find information indicating that the patient did indeed receive treatment here. You believe this is harmless since you didn't share the records with anybody. Is it okay? Answer: no. This is not acceptable. Even if information wasn't shared, accessing PHI protected health information without proper authorization is still a HIPAA violation. HIPAA case scenario 2. Question. You see that your neighbor's daughter is receiving treatment at the emergency department. Worried and concerned about her, you decide to call your family, alerting them of her presence and treatment. Is this okay? Answer. No. HIPAA forbids disclosure of PHI, protected health information, to all individuals whom the information was not specifically required to be released to, which includes your family and friends. HIPAA case scenario 3. Question. After volunteering with patients, you go home and tell your family about your experience. You mention how delighted the kids were to see you, and you talk about the medical conditions that some children have and how it makes you want to devote more of your time and life to volunteering or working in a medical profession. Is this okay? Answer. Yes. The individual in this scenario did not reveal any PHI, like a diagnosis and name of a particular patient or family member. However, keep in mind that if any PHI was mentioned along with the name or anything that could identify someone, then it would be a violation of that patient's HIPAA rights.